Hello, I am Ursula Falkling and I am a dentist. Today I would like to talk about halitosis or chronic bad breath. It's something that means mouthwash or even some brushing can't resolve. A girl's night out or beers with bros could give you more than a hangover. Even though it's a liquid, alcohol can actually dry out your mouth, which encourages the bacteria that cause halitosis. Drinks with caffeine, spicy food, and cigarettes can too. During sleep, you produce less saliva, and that explains the awful morning breath. Saliva goes a long way for your dental health and your breath. It rinses and removes unwanted leftovers from your mouth, helps break down food when you eat, and provides disease-fighting substances to help prevent cavities and infections. If you don't make enough saliva, one sign may be halitosis. Bacteria on the tongue is the leading cause of bad breath. Clean your tongue with your toothbrush or even a tongue scraper. The tongue scraper do a slightly better job actually. When you cut out carbs and boost the amount of protein you eat, your body starts burning fat for energy. That process makes compounds called ketones, which cause bad breath. In this case, better dental hygiene won't solve the problem since that's not the root case. Your best bet is to mask your breath with sugar-free gum. As if they weren't annoying enough, respiratory tract infections like colds and bronchitis can also give you bad breath. That's because odor-causing bacteria like to feed on mucus. Yeah, that's gross. And if you have a stuffy nose, you are most likely to resort to mouth breathing, which can dry out your mouth. More than 400 prescription or over-the-counter drugs, including antidepressants and allergy remedies, can decrease saliva flow. Changing your medicines isn't always an option, so the American Dental Association recommends you stay hydrated and chew on sugarless gum to keep your mouth moist. Special oral rinses can also help. Thompsons Stones are small whitish clusters made up of hardened bacteria, food particles, dead cells, and mucus that got trapped in the ridges of your tonsils and the back of your tongue. They are generally harmless except for the smell. They will often dissolve on their own, but you can sometimes speed up the process by gargling with salt water. Dry fruits are good, but they are very high in sugar and odor-causing bacteria love to feed on the stuff. Just in 1/4 of a cup of raisins has 21 grams of sugar. The same amount of dried apricots has 70 grams. That's like eating 4 to 5 teaspoons of pure sugar. Plus, dried fruit is sticky, so it can get trapped on and between your teeth. After a snack like this, be sure to floss and brush, or at least rinse your mouth generously with water. Reflux is a common digestive disorder. Your bad breath may be from some undigested food coming up, or it could be irritation from stomach acid that is giving you postnasal drip. Ask your doctor for help if you get heartburn often. Not sufficient oral hygiene results in cavities, gum disease, and it's the major cause of bad breath. Ill-fitting dentures can also cause the same problem. Oral hygiene is the key to most bad breath issues. So my recommendation are, which I hope you will follow, that you brush your teeth at least twice a day. That's what all dentists will recommend you. Flossing reduces the build-up of food particles and plaque between your teeth. Just normal brushing only cleans around 60% of the surface of the tooth. So flossing is very crucial for you to do. If you have a dentures, you have to clean them as often as you would clean your own teeth. You should also change your toothbrush every 2 to 3 months. Remember to brush your tongue. Use tongue scraper, it could be useful. And to avoid a dry mouth, I would recommend you to drink plenty of water. Avoid alcohol and tobacco, both of which dehydrate your mouth. Chewing gum can help stimulate the production of saliva. If the mouth is chronically dry, I would recommend you to look up a doctor that might help you with some medication that stimulates the flow of saliva. When it comes to diet, I would say avoid onions, garlic and spicy food. It's not only the option because spicy food are quite good, but at least you can reduce the amount. I would also recommend you to reduce the amount of coffee and alcohol consumption. Sugary foods are also strongly linked to bad breath, so avoid sweets as much as you can. If breath odor persists despite controlling these factors, it is recommended that individuals visit to a doctor to look for more help to resolve those conditions. I hope this is helpful to you and that you soon, if you suffer from halitosis, will be able to resolve your problem. So good luck. Thank you for today. Bye.